The United States Intermountain West is a place of beauty and ugliness. The hidden underbelly of this scenic area conceals a staggeringly high suicide rate. In epidemiological terms, a rate is generally defined as the number of deaths per 100,000. According to the Centers for Disease Control 2011 data, the year of the most current data available, suicide is the 10th leading cause of death among all age groups in the United States. This equates to a national death rate of 12.1. In the states of the Intermountain West, and you'll see a map of that area on the next slide, the rate is 18.3. In Wyoming, the suicide rate is 20.4. If Wyoming were its own country, it would have the 9th highest suicide rate in the world. Park County, Wyoming, weighs in at a whopping 40 suicides per 100,000. If you're curious, the rate in my home state of Minnesota is 12.4, which is about the U.S. national average. Research shows a positive association between suicide and altitude, which provided me with an interesting puzzle. Correlation does not necessarily equate to causation, and I set out to unravel the mystery as best I could. After the initial literature search, my focus quickly became the investigation of whether a syndemic was occurring in the Intermountain West. Syndemic theory was developed by anthropologist Merrill Singer to explain how two or more physiological issues become exacerbated by cultural factors and result in a health problem. This theory has been used extensively to study the transmission of HIV. It is my contention that the effects of altitude on the body, when combined with the physiological changes in the brain caused by mental illness, are exacerbated by the cultural environment found in the Intermountain West, namely the cowboy culture, something that is much more complex and extensive than I imagined at the onset of my project. Originally, I was going to study the suicide phenomenon in the entire Intermountain West. Upon consultation with the faculty in my program at Metropolitan State University, it quickly became clear this was way too ambitious. I eventually narrowed my focus to Park County, Wyoming. Park County is in the upper northwest corner of Wyoming and includes the city of Cody, which is a popular summer tourist destination because of its proximity to Yellowstone and Grand Teton National Parks. The county is bordered by Montana to the north and Idaho to the west, which are also both part of the Intermountain West and the associated culture. The draft of my project really began to form as I conducted the literature search and worked on the annotated bibliography. I started with statistics from the epidemiological data and worked my way through describing the appearance of an altitude-suicide correlation. I then started putting this information into the framework of syndemic theory, as well as that of systems theory from biology, and Dr. Thomas Joyner's interpersonal suicidal behavior theory, originating from the discipline of psychology. Joyner's theory, which is woven into my thesis, maintains that three conditions must exist for a suicide to occur. 1. Thwarted belongingness. 2. Perceived burdensomeness. And 3. The ability to enact lethal self-harm. The pervasive cowboy culture appears to figuratively strap jet engines to each of these three conditions, causing them to accelerate quickly. Finally, I incorporated the use of Swiss cheese theory as a model to explain how the perfect storm of factors churn and collide, resulting in an excessively high suicide rate. Swiss cheese theory is used extensively as a model in the explanation and prevention of disasters and errors in aviation, engineering, and healthcare, and was developed by Dr. James Reason, a psychologist. I had a few issues, questions, and concerns that came up in the course of my research. The first was how to determine the level of suicidality for an entire community. To accomplish this, I decided to become a certified autopsy investigator. The idea was to see if methods of determining suicidality in an individual or micro level could be applied to a specific geographic population on a macro level. Having met the rigorous prerequisites for the psychological autopsy course, I was accepted into the program and flew to Boston in January 2013 to study the procedure. After completion of a highly scrutinized initial case study, I was granted board certification by the American Association of Suicidology as a psychological autopsy investigator. Choosing the appropriate site was also of paramount importance. A review of suicide statistics and altitude charts helped me zero in on a place. Once that location, Park County, Wyoming, was identified, I had to arrange for travel and a place to live while I was there for 23 days. I went on a reconnaissance mission with my father while on our way to a vacation in Idaho. A week after my return, my wife, daughter, dog, and I all piled into our car and drove to Cody, where we rented the main floor of a house in a quiet neighborhood. Staying true to anthropologic ethnographic methods, we lived among the native population and led our lives as much as possible as they led theirs. I kept detailed notes of observations and had audio recordings of interviews transcribed. Each night, I also conducted a family debrief, jotting down observations and experiences my wife and daughter relayed. Lastly, I needed to figure out how to most efficiently perform an analysis of the largely qualitative data I had amassed. Fortunately, a course I took on organizational anthropology provided me with the answer, a software program called Atlas TI. Written documentation is uploaded to my iPad, which allows for tagging and sorting of information. This allows for trends and themes to be more readily visible. The approach I am taking to study the suicide phenomenon in Park County, Wyoming is unique. It appears that no research exists that uses syndemic or Swiss cheese theory to study suicide, nor has anyone used the psychological autopsy on a community-wide level. I'm calling the use of the psychological autopsy applied on a macro level an anthropsy. This is short for an anthropological or cultural biopsy. Lastly, no one has studied the altitude suicide phenomenon in an interdisciplinary manner. All conjecture to this point has been rooted in a strictly biological context. To bring my project more into focus for completion, I am continuing my research into the biological aspects of the suicide phenomenon. This includes researching aviation medicine, the physiology of mountain climbing, and the neuroscience of brain chemistry and imaging studies in depressed and suicidal patients. The last 3 years has produced a great deal of research into the biological manifestations and changes in the body due to both mental illness and high altitude. Of greatest interest to me is the visible damage to the area of the brain called the amygdala, caused by chronic alcoholism, prolonged depressive states, or repeated exposure to high altitude. We have yet to integrate these findings and bring in the cultural and psychological pieces. This is what I intend to do. I am also exploring systems theory in greater detail and the concept of the feedback loop in particular. In other words, that suicides and the reactions of others to this manner of death influence culture in a negative way and feed into or reinforce the factors contributing to the syndemic in the first place. Suicide is a major public health problem, not only in the United States, but the entire world. It is my sincere hope that my efforts will contribute to the overall body of knowledge on this important problem and will ultimately help prevent deaths from suicide. I want the work I have done in the MLS program to transcend the classroom and help people in the real world. Your support of the work we do at Sumra Solutions is a critical piece of that journey. Please accept our deepest gratitude for your continued involvement.